Good afternoon. I want to welcome you to the second webinar for the NCREW program. We're going to wait just 1 or 2 more minutes to see if others join us. So please be patient as we wait to begin. Go ahead and get started. Again, I want to welcome you to our second webinar to support applications to the NIH HEAL initiative, the Native Collective Research Effort to Enhance Wellness program, addressing overdose, substance use, mental health, and pain. My name is Kathy Etz, and I'm the director of the Native American program at the National Institute on Drug Abuse. And I will be joined throughout this webinar by my colleagues who are also working on the NCREW program. So we want to begin with a land acknowledgement. We acknowledge that the NIH exists on the traditional lands of the Piscataway and Anacostan people, past, present, and future. We honor the land itself and the Native people who belong to this land. And we also commit to our responsibility to take action through listening, learning, and responding to center Native American voices and communities in our work. So this slide covers a few housekeeping items. Before we dive in, we'll talk about these. So please be aware that this webinar is being recorded. The recording of this webinar and associated materials will be published on the NCREW website. You will have the opportunity to submit questions today, and we ask that you do that through the Q&A link located on your screen. And if you have any technical difficulties during this webinar, please write a message in the Q&A box or email Caitlin at the email provided on this slide, and somebody will assist you. And if all else fails, email NCREW at nih.gov, and we'll try to monitor that as well. So for the agenda for this webinar is here, and basically we're going to begin with an overview of NCREW, briefly discuss the ROAs, highlight key dates and the application components, and then we'll be sharing more detailed information on how to apply to this program via eRA Commons and Assist. So let's begin with a fairly brief overview of NCREW. So first of all, I want to describe some program resources. The NIH held a webinar on July 28th to share information on the NCREW program, the associated research opportunity announcements, or ROAs, and answer questions. The recording of that webinar is available on the NCREW website. And the 2 research opportunities are also listed on this page for quick access, as is the link to the questions and answers website. So the NCREW program is part of a broader initiative at the NIH, and that broader initiative is called Helping to End Addiction Long-Term, or the HEAL initiative. HEAL bolsters research across the NIH to improve prevention and treatment of opioid misuse and addiction and improve pain management, including understanding and treating pain. HEAL funding is allocated by Congress to address the opioid public health emergency. And for this reason, all HEAL funded programs must include a focus on addiction or pain, or both. We emphasize wellness in the name of this program to emphasize strength-based approaches to addressing challenges such as the opioid crisis. I want to note that all funding for NCREW is provided by HEAL, and that you can find more information about the broad HEAL initiative by following the link on this slide. The NCREW program was designed to respond directly to tribal consultations, also building from what the NIH has learned from communities over the years. So on this slide, you see some of the goals for the program. Its overarching principle seeks to support research that is community prioritized by tribes and Native American serving organizations. These are organizations that we will also refer to as TNASOs throughout this presentation. NCREW has 3 broad goals, and they are to support TNASOs to lead community prioritized research projects, including research that elevates and integrates Indigenous knowledge and culture. The second goal is a really important goal, and this is to enhance capacity within TNSAOs to conduct locally prioritized research by developing and providing novel, accessible, culturally grounded technical assistance and training, resources, and tools. And the third goal is to improve access to and the quality of data on substance use, pain, and related health and well-being factors to maximize their potential use for use in local decision-making. These goals are purposefully broad to facilitate supporting what communities prioritize within the parameters of the HEAL initiative. The NCRU program is grounded in the understanding that research prioritized by Native communities is essential for enhancing culturally grounded, strengths-based, effective, and sustainable intervention strategies, ultimately promoting health equity. NCRU relies on some key definitions, and I want to begin with those. First, tribes and Native American serving organizations are defined as federally or state-recognized tribes or organizations with a core mission to serve this population and or a track record in serving Native Americans, and that are poised to reach this population. Second, for the purposes of this program, Native Americans are defined as American Indians, Alaska Natives, or Native Hawaiians. And finally, ally organizations are defined as organizations with the ability to document a track record of partnering successfully with Native American communities. This slide is a little bit complicated, but it breaks down the components and phases of the NCRU program. So let's look carefully at the boxes. So if you look across the top in the purple box, you will see that the NIH intends to commit approximately $268 million over 7 years to support the NCRU program. Below that, in the red boxes, you can see that there are 2 phases planned for the NCRU program. We're focusing today on phase 1, which is approximately 2 years. NIH anticipates committing $25 million to funding applications in response to the ROAs we are discussing today. The components of the program are broken down on the far left side. These components are the NCRU TNSAO's research and data projects, and then the Native Research Resource Network, or NRRN, and possibly you'll see that there are other components listed, and those will be developed as determined to be necessary as the program evolves. So in today's webinar, we are focusing on phase 1 and the active research opportunity announcements or funding opportunities that are currently on the street. You see those in the middle there, ROA-23-007 or ROA-23-008. You'll note that we show the phase 2 here, and you can see that phase 2 will build on phase 1 and is anticipated to be approximately 5 years. And the NIH intends to commit $240 million to the phase 2 portion of this program.
Thank you, Kathy. Hi, everyone. I'm Barbara Odekirk. I'm a scientific program director with the NCRU program. And I'm going to spend a little bit of time just giving a quick overview of the research opportunity announcements, starting with 007. This is the research and data projects led by tribes and Native American serving organizations. And I said this will be a quick overview, and that's because we did cover both of the ROAs in the first webinar. So we encourage you to go back and view the recording of the first webinar. And of course, all the ROAs provide all of the details. So this ROA solicits applications from tribes and Native American serving organizations to develop, plan, or implement research studies, improve data, such as access to data or the quality or availability of data, and enhance capacity to engage in research. As Kathy said, the parameters of what NIH is asking for under this ROA are intentionally broad to support the submission of what tribes and Native American serving organizations and communities prioritize. As Kathy mentioned also, the HEAL funding is a congressional appropriation. Thus, projects must explicitly include a focus on overdose, substance use, including opioids or stimulants, or pain management, or both. Projects do not need to include both pain and substance use factors, but must include one or the other. Projects may also include experiences or factors related to these outcomes. So for example, wellness or mental health or alcohol use. It is also important to understand what will not be funded. Direct services or projects that solely intend to intervene in the absence of a research or research capacity component are not within the research mandate of NIH and will not be funded. Research capacity building that is not focused on HEAL-related research or data projects will not be funded. And similarly, research or data projects without a focus on topics or outcomes related to the HEAL initiative will not be funded. Applicants are encouraged to propose projects that generate knowledge to inform decisions and implement strategies to address overdose, substance use, or pain management. Applicants are also encouraged to consider a range of Indigenous and/or Western methodologies and approaches. This includes those that rely on Indigenous knowledge or lived experience of Indigenous researchers or practitioners. Importantly, priority consideration for funding for this ROA will be given to applicants who document a commitment to advance their research capacity to participate in future NIH research, and to meritorious applicants who have not previously applied or received NIH funding. So next, I'll give a quick overview of the next ROA, OTA-23-008, the Native Research Resource Network. This ROA solicits applications from tribes and Native American serving organizations and/or ally organizations to participate in a multi-component and agile Native Research Resource Network during phase 1 of NCRU. This network will work responsively and collaboratively to develop and provide comprehensive real-time resources and support to TNASOs, identify effective strategies and approaches for supporting TNASOs as they develop and conduct HEAL-related research and/or data improvement projects, and identify and implement activities to maximize investments and facilitate long-term sustainability of research data gains made by TNASOs. For phase 1, this Native Research Resource Network is structured to provide a broad range of research support that cannot be fully predicted in advance of receiving applications. It is also structured to be agile and allow for flexibility in modifying activities or partners or even formal partnership structures. So this slide provides examples of potential activities in the 4 broad categories that NIH anticipates might be needed. It also includes an other category because NIH recognizes that tribes and Native American serving organizations and ally organizations are best positioned to identify and anticipate innovative and effective supports that might be needed. Some examples of technical assistance that we anticipate include tracking and reporting on activities, identifying study designs, assistance with financial accounting systems, and grant writing and monitoring. Moving to the next category, NIH is seeking 2 or more organizations from the Native Research Resource Network to lead coordination and reporting across the NCRU program. Having more than a single organization provide coordination allows some opportunity for tribes and Native American serving organizations to specify how and with which organizations they would like to collaborate for coordination. These coordinating entities might gather information and resources across sites and manage the coordination of comprehensive real-time technical assistance and resources. Looking at the partnership development category, example activities include the development and implementation of innovative strategies for fostering and sustaining partnerships and providing support for cross-site meetings. Under the last category here, examples of work that might spur innovation and accelerate progress include efforts to identify, consolidate, and disseminate best or promising practices for developing and enhancing research capacity, possibly leading to the development of a research readiness model. Award recipients might report on different structures and strategies TNASOs employ to carry out research, or might develop an innovative program or process for training and mentoring scholars. Again, these are just examples. Note that NIH will prioritize applications with proposed activities that are likely to benefit greater numbers of tribes and Native American serving organizations. We have a few slides on milestones because we recognize that these might be new for some applicants. And for both ROAs, applicants must submit a set of draft milestones. Milestones should be measurable events and indicate progress and/or completion of each proposed task with a timeline. The draft milestones will align with activities proposed for phase 1. All final milestones will be negotiated in collaboration with NIH and based on the application and other NCRU program resources and needs. So here are 2 examples of poorly versus well-defined milestones. An example of a poorly defined milestone is collaborate with partners, whereas the well-defined milestone might be attend 4 teaming meetings with other NCRU program recipients within the first 12 months of the project. In the second example here, decide how to build research capacity can be better defined as engage 7 to 15 community members in bi-monthly meetings to develop research capacity objectives, that then submit those objectives within the first 12 months. Please note again that these are really just examples, and we anticipate applicants will propose a broad range of different milestones based on the proposed work in phase 1. Next, I'm going to turn the presentation over to Jennifer to talk about key dates.
So as Kathy previously mentioned, we are currently hosting webinar 2 today, and we will offer a 3rd webinar on October 3rd focused on questions and answers. The optional letter of intent is due this Friday, September 1st, and all eRA registrations should be completed by September 20th. We encourage you to start the process in early September. The last day to submit questions, excluding technical assistance questions, to the Q&A is October 17th, and the full application is due via Assist on November 1st, 2023. Review will occur in January of 2024. Following negotiations with recipients, the first awards are expected to be issued with the earliest start date of June 1st, 2024. So now the application components. NCRU applications require multiple components, which are listed here on the right of the slide. Details about the components and what to include can be found in each respective ROA. Components not discussed in this webinar were discussed in the first webinar, and you can view that recording. Applicants are encouraged to submit a letter of intent via email by this Friday, September 1st. Letters of intent will help the NIH prepare for providing technical assistance and plan for a timely review of applications. The letter of intent can include the legal name of the applicant and partners, contact information for key persons, descriptions of TA that might be needed to apply, and a brief description of the project. Note that the letter of intent is not required, is not binding, and is not considered an objective review. Because of this, even a very simple 1 or 2 sentence email to indicate you plan to apply will be extremely helpful for our planning purposes. So in response to OTA 23-007, as Barbara stated, please consult the ROA for detailed budget reminders. Each ROA has specific budget criteria that should be adhered to. The most important guidelines to note are that the proposed budgets should be realistic, well justified, and up to a project period of 2 years. NIH anticipates annual total budgets will range from $200,000 to $550,000, depending on the proposed activities and resources, but there is no annual budget limit. Most importantly, the budget must reflect the needs of the proposed work. If your project has a consortium or a partner, please do include a detailed budget for that consortium for each year. In response to OTA 23-008, as previously stated, please consult the ROA for detailed budget requirements. Each ROA has specific budget criteria that must be adhered to, and the most important guidelines to note are that the proposed budgets should be realistic, well justified, and again, up to a period of 2 years for phase 1. NIH anticipates annual total budgets for this ROA will range from $500,000 to $1.3 million, depending on the proposed activities and resources. But again, there is no annual budget limit. Most importantly, the budget must reflect the needs of the proposed work. If applying with a consortium of partners, again, also for this ROA, please provide a detailed budget for each year and for each consortium and partner. For both ROAs, budgets should reflect requested line items, such as personnel, which are subject to NIH's salary cap, travel, materials and supplies, detailed breakdown costs for subawards and consultants, other direct costs, such as for data management sharing costs, and if applicable, indirect costs. If your organization has a negotiated indirect cost rate agreement, please apply this rate to the budget. If the applicant does not have an approved facilities and administrative costs rate agreement, that's also fine. Please, you can propose a rate for our review, the NIH's review and consideration. So there are no budget justification templates for NCRU for these programs. So please include a budget justification to explain each cost requested for your proposed project. For example, if $12,000 is requested for travel for 2 individuals to attend 4 teaming meetings required by the research opportunity announcement, please so state. The narrative should match each cost identified in the table or Excel sheet that you provide. If applicable, please also include a budget narrative for each subaward partner where funds are being requested. Okay, because there are no budget templates for these ROAs, the following 2 slides depict a fictitious sample budget only. It's for a 12-month budget period and request line items, as you can see. This budget starts with personnel that are necessary to complete the aims of this project, which of course will vary widely. Here we have the PI devoting 3.6 calendar months at a requested salary of $27,777. The fringe for her devoted effort equals $8,333, bringing the total request to $36,110. There are 2 to be named personnel in this project, as you can see, a research assistant and a behavioral health and cultural lead. Beyond that, there are line items that you can see: materials and supplies, travel, publications, research participant payment incentives, training, etc. But again, these will vary widely from project to project proposal. As we continue to this sample budget, you can see that we have noted there is a consortium whose direct and indirect costs add up to $150,000. I would need to provide a separate table or Excel to account for the $150,000 request in detail. Here we have the subtotal direct costs and then the indirect cost line. If your entity has an F&A rate, here's where it would be applied. In this case, my sample budget does not have an established rate and is proposing 10%. I've applied this to the maximum indirect cost base of $227,343, which is the total of the previous budget sheet and this, which is my subtotal direct cost minus my total consortium costs. And then I added it up for the grand total of $400,077. So that's just a fictitious sample budget. So, as a reminder, the application submission system and interface for submission tracking or ASSIST platform must be utilized to submit all applications. ASSIST is a web-based platform used to prepare and submit applications electronically to the NIH and other public health service agencies. As a starting point, please visit the website referenced via the links on the slide. There are step-by-step tutorials and specific instructions to generate an NIH other transactions application. To prepare to submit your full application, we are providing the following guidance. Before the time of submission, the principal investigator and their organization must be registered in eRA Commons. Please note that this can take up to 2 to 4 weeks to complete, so thank you for starting this process early. In addition to the PI, there must be someone designated as the recipient's signing official. It is desirable, though not required, that other key personnel and the whole applicant team are also registered in eRA Commons. Once registered in eRA Commons, the Assist platform can be accessed for the full application submission. To complete the application, users must have access to a browser, a PDF generator, and Adobe Reader software. There should be 4 components to your completed application: a core form page, the abstract, the aims, and 1 PDF attachment, as stipulated in the ROAs. If you combine information from different sources, please do not use bundling or portfolio features which combine multiple documents into a single file by providing links to the individual files. For full applications, please carefully consult the detailed instructions in the corresponding research opportunity announcements. Should anyone have questions about their registration in eRA or application submissions via Assist, please reach out to the eRA Commons Help Desk at 866-504-9552 and reference OTA 23007 or OTA 23008 in your request for assistance. If issues persist after you have reached out to the eRA Service Desk, please reach out to us at ncrew@nih.gov. For any questions regarding your application content or budget, please reach out to us at ncrew@nih.gov. Thank you, and I'll pass it to my eRA colleagues.
Hi, I'm Laura Remen from eRA, which is part of NIH. We're in the Office of the Director. And what I'm going to be doing over the next half an hour or so is to do a walkthrough of the process that will be required to register your organization in eRA Commons. And then I'm going to go through step by step, field by field, in Assist to show you how information needs to be entered. The agenda is, again, as I mentioned, walking you through the registration, showing you that there is, in fact, a streamlined process indicating where you will not need to have a UEI at the time of submission and registration. To highlight what Jennifer mentioned, you must have an individual who has the signing official, that's a person who has signing authority for the organization, and another individual with the role of principal investigator or program director, and it's just an NIH term. They can be the same person, but they need separate registration. One is an administrator, the other is a scientist or a scientific role. We'll walk through Assist, and then most importantly, we're going to walk through how you complete the application, run it through business rule validations, preview the image, submit the application, and most of all, track that application, because if you can't see it, we can't see it, and we can't fund it. So really important to see it all the way through. So with that, I'm going to now show you first eRA Commons. So this is, and you can Google eRA Commons and it will take you to this page. I just want to indicate that I am not in the exact environment you will be using. I'm not submitting an application. So I'm actually in what we call a lower environment. In this particular case, it's our test environment. So at this point, if you're going to want to register your organization, you're going to go to Register Organization. It's going to take you to this particular screen. And for the purposes of the 2 ROAs we have been talking about, if you are not registered for Commons yet, and you do not have a UEI, which is a unique entity identifier, you want to check NIH Other Transaction Authorities, hit Next. And then it's going to ask specifically whether you have a DUNS UEI or whether you don't have one. And if you have a unique identifier, great, you can enter it. If you don't, you want to select I do not have one. And then basically this is saying that you understand that you will need a active SAM, which is a SAM registration at the time of award. So checking that box will activate then the next. And now you want to put in information about your organization. And I will apologize for my typing skills. You have to put in the country before the state, and we do that because our colleagues in Canada use provinces, and so we're going to show you provinces versus state, depending upon what you select. So we do have type ahead functionality here. These two emails are for individuals at your organization who will be responsible for closing out the award at the time it is terminating the end of the project period, as well as the person who will be notified about an award. They can be the same person, they can be different. It's totally up to you. So, for the purpose of this discussion, I'm going to just basically put in a standard email. And then this is the information that needs to be here. What needs to be entered is the information for the individual who is doing this registration process, but most importantly, has signing authority for the organization. So this indicates, so this one basically said that this name has been involved. So the username, the Commons username needs to be unique. And this is not a time to be creative. Individuals with the administrative rule, if they went from my favorite university to State University X, they will get a new Commons identification. A scientist or an individual with the role of PDPI keeps their registration because they become affiliated with the organization they are at. So it is not a time to be overly creative. We have some really good examples of locker room humor. There we go. So here's my registration. Everything is set, and I'm not going to be submitting because I don't want to create additional accounts. But what would happen next is I'm going to submit. I'm going to get an email, a confirming email, and it's really important to reply to that email. And that will happen soon after you submit. And then when your registration is complete, you will receive another email. And again, important to respond to that email. We are looking for those responses to confirm that this is a legitimate request for registration. And that is the most common reason for delayed registration is the individual who registered the organization failed to respond to the email. Once you have registered, you have the ability then, and it's provided in the instructions on how to affiliate individuals at your organization and give them Commons accounts. So those instructions are very, very clear on how to do that process. So I'm going to come back to Commons Home. So if there's any questions on that, I'll pause if anyone has anything they want to ask relative to Commons registration. We can take those. Otherwise, I'll move on to eRA into assist. So eRA Commons, just to sort of set the scene for you, is a portal through which information is exchanged between NIH and the applicant and NIH. So for example, when you submit your application, we're going to go ahead and process that application. And if there are errors or warnings, you would be able to see those errors and warnings in eRA Commons. As you'll see, Assist does it up front. You'll actually see them in Assist, but for other submission system methods, that information is available. When you have your review outcomes are made available through eRA Commons. And then as you'll get further into the process, if you have an award, it again is the portal by which information can be exchanged with the folks that are managing your application or your award in their portfolio. Similarly, as I said, we post things. Similarly, that as you'll see today, when we have processed your application, you will be able to log into Commons and see the application that we have processed. It is part of your Commons account, and it will live in what we will talk about in a little bit later, the grant folder. So I've now completed my registration. I'm Sharon Verond. I'm going to put in my username and password. And you can do this directly in Assist. You can also do it directly in Commons, because as you can see, here are the links to various functionalities within Commons. So we're going to click on Assist. And this is the landing page. And so here is where the process begins. So once you've decided whether you're going to compete for OTA 23-007 or OTA 23-008, you will enter those numbers here in the following format. Now, I cannot use those because, again, I'm in a lower environment where I don't have access to those two ROAs. So I've prepared something for the purposes of this demonstration. But you want to enter it in the format of an OTA hyphen 23 hyphen number, in your case, 007 or 008. And then I'm going to hit go. What you'll see in a second is that as soon as you initiate the application, it is going to be given a unique identifier, which I'll point out in just a second. This will allow you to take a break, to stop, to go back and do something else, and to come back and look for the application later. This is the box that you will use. And so if you have already initiated and you want to come back and work on the application again, you're going to hit this box, search applications. The other thing I want to point out is that we have links out here to the Assist user guide and some other information. This particular application guide is for full grants, and so you do need to follow up with the links that Jennifer indicated earlier. So we're going to go ahead now and initiate. And this is the landing page. And so it shows you the OTA that you have selected. If it has you've already heard about what the two titles are for the two programs. And then it will provide information about the opening date and the closing date for those opportunities. And then again, this is one of the major advantages of having that registration and completing profiles, is that we pull information about you and your organization from eRA Commons. And so that way it knows that I am from the University of California, San Diego, and it knows what the address is. So again, this information is coming from eRA Commons and was established at the time the organization was registered. There's one thing that you have to do on this form, and that is to enter a project title. And so this can be edited later, but it is the information required for the application. The other thing you can do here is once you have affiliated your PDPI with your organization, you can fill out their information here by pulling their information from their Commons account. So in this case, I'm going to show you what that looks like. In this case, the Commons ID of our PI is AA Bella. I submit, and you'll see that the information is pre-populated based on the registration and affiliation of this individual in eRA Commons. So now we're going to initiate. And let's do the lay of the land. And so the couple of things to highlight. The left-hand panel is what we call the navigation panel. Because I have the role of SO, signing official, I see buttons for copy and delete. If I had gone in and initiated as the PDPI or someone else, again, it's reinforced what Jennifer said, you just need to have a Commons registration to initiate the process. And so again, I have these two because of my role. And I'll just briefly go in and talk about these different forms. So manage access allows you to build your team. So currently, since I have initiated, only I am part of, because I have initiated and I've set up the PI when we first initiated, we both have access to the application. If you wish to add another individual for your team, A, you can do that. B, they need a Commons account. So we'll show what that looks like. Add another user. In this case, our user's Commons name is C-Glass. We're going to, and then this allows you, this has not a lot of resonance in the OTA world, but it does allow you in the grant world to restrict access to things like the budget or non-budget sections of the application. So we're not going to put any restrictions. We're going to submit. Here's the information on that individual, and then we're going to save. So now I've built my team. I've built my team. We're going to return to the application. And then you don't have to worry about this. This is we always have the ability to add some new forms depending upon what's needed by the ROA. In this case, there's nothing that you need to pull in. These two are very important. Preview application allows you to see what the application image will look like when it's assembled at eRA. Validate the application, make sure that you are compliant with all business rules. And then you'll see we're going to have to update the status right before we're ready to submit. So the other thing I want to highlight is, again, what Jennifer indicated, is that this is the application. This is one of the 4 elements that you must have for your application, which is completing the core form. So to complete the core form, there's a couple of things that I just want to lay out on the table. So edit basically protects this form from anyone else editing it at the same time. So no one can overwrite information that you have been adding. The other thing is down at the bottom is save and keep lock. So you want to save the entries, but you don't want anyone to come back. This has a 45-minute timeout. So if you forget to release the application, it's automatically released within 45 minutes. Save and release saves the information and then allows anyone else to work on it. Cancel and release basically removes anything that you have added between now and the previous saving. These are the things, the three other essential components, the specific aims, the abstract, and the attachment. But we're going to walk through the application in a step-by-step manner. So we've clicked edit. You are submitting an application and it is new. Should you discover that you made an error, like right after submitting, you can correct that error and resubmit. When you do that correction, you're going to need to change the status back to work in progress, and I'll go through this again. Hit a change corrected, and you will need to enter the tracking number, which I will point out again later on in this box here. Okay, but for the purposes, everybody's going to get it perfectly right the first time. So you want to hit application. Because my organization had a UEI, it is displayed here. Otherwise, the organizational information is pulled from Commons. Similarly, the EIN, the employer identification number, if you do not have it, enter 12 ones. This is the title that was entered in when we initiated the application. If it is not appropriate or you want to change it, you can do so here. These are the recommended start dates and end dates. And again, you got a timeline from Jennifer, so this would be where you would want to put in that information. For the sake of our demo, I'll just put in the beginning of the calendar year. All right, so here we've done that. Now, I'm going to go down here and save because I want to show you a really nice feature of Assist. So it's doing a quick validation and it's telling me, oh my goodness, I have all of this missing information. And so what it allows you to do is to continue on if that's what you want to do, or you can return to correct the errors. And what you'll see in doing that is that Assist points out where sections are either incomplete, and again, these are incomplete, or you have not completed required fields. And required fields are denoted by an asterisk. So it's clearly these are errors because we haven't completed this section of the application. So what we're going to do here is edit information on the PDPI. So this is the person who is in charge of the project. And we need their contact information in terms of their address and email. Again, it wants country first. And then it will allow you to put in a state. It prefers 9 digits. Zeros work. And lastly, the email. We're going to save and release. So I do want to make an important point here in terms of the PDPI, which we'll return to in a second, is we do allow or do support multiple PIs. So again, coming back to so this allows for individual. So if we add an additional PDPI, again, the expectation is that that person has the role of a PDPI, is another sort of investigator on the application. And for that reason, there is not a place here to indicate outside of what their professional title is, their role on the application. So we really don't have a mechanism within this particular field itself to capture the role other individuals serve on the project. So if that's something that's important, then clearly that would be something that you would want to incorporate in something like the budget justification. So let's complete the rest of the application and see what it's going to look like when we run our business rules validation and then submit the application. So we're just about done. So we're going to put in information for the business office. You can use tab to navigate. You do really just need to put in the material, the fields that are highlighted. So the other thing as I'm walking through this, I do want to make sort of a case for is it's really a very efficient if you have all of your PDFs prepared ahead of time. And that reminds me to, again, emphasize that all attachments must be PDFs. If you are preparing your budget as an Excel spreadsheet, it's fine. It just needs to be printed as a PDF. I'm happy to answer more questions on that as well. You must read and sign to this agreement that basically, to the best of your knowledge, everything that you have put in the application is true, not false or fictitious or fraudulent. Then you want to put in your total dollar amount requested, and this would hopefully align with what you've put into your budget. You can completely ignore the human subject information, whether it's yes or no. You are not going to be required to put in additional information about human subjects at the time of submission. Very important then here, these are the other two requirements that Jennifer mentioned. You need to enter an abstract. So again, I've prepared all of my material ahead of time. So it's going to go to a particular file where I've put all this information. So put my abstract in, put my specific aims in. So you can see it goes pretty quick when you have those all laid out ahead of time. I'm just going to throw in a couple things here. I did not prepare a single concatenated document, but let me just put in a few things so that you can see what this is going to look like when we preview the application image. One thing I do want to just again re-emphasize is do not, if you're going, since we're making a concatenated PDF, a single PDF, do not attach. So think of having if you had a fillable form, and I'm not saying that you do, and there's a place for you to attach. So if I can show you this probably easier than telling it, but if it's asking you to attach something else, don't do it there. So for example, we have a fillable budget form for NIH, and the justification, the budget justification is attached to that form. When that form is flattened, that justification is smushed away. It can't be accessed. So make sure that every file or every attachment that you have been added to is a separate attachment that you then concatenate into one PDF. Hopefully I've said that clearly enough, but you don't want to basically have child-parent relationships. Just about done. We are ready to submit. So we've attached everything. Again, you will be attaching just a single PDF. We're going to save and release the lock. Now we're going to check for errors. We got some. So it already said we have some errors. So we're going to go down and complete where those are. So we forgot to add the state, California, and I forgot to answer the question here. So now we should be good. Save and release. So that means we've completed all of the required fields. What we're going to do next is validate the application. This is running it against all the business rules. We have one error. Okay, so this is what I was hoping to do. So what I attached is a form that is not a flattened PDF. So this is not going to allow the application to be saved. So I need to go in and put in or basically take that document and print it to a PDF using Adobe to make sure that it is then compliant. So that's what you would need to do if you see this message. It means that you have a particular attachment that's not, and it tells you what that particular attachment is. In yours, you're going to have one attachment, so it could be one PDF in there that's going to mess it up. So that, in which case, it's just going to be a little bit harder for you to find. So we'll go back and we will correct that. Oops, I forgot to edit it. And all I need to do is I'm going to basically take that one and save. So it's now basically deleting it. All right, so now we're ready. So we're going to get ready to submit the application. To do that, we're going to update the submission status. We're going to go to to update the submission to ready to submit. At this point, and you can put a comment in here if you want to or not. You're good to go. Add comment. And at this point, if you have been preparing this application and you have a role other than PDP, other than the SO, you need to send an email to your SO, the person with signing authority, because they are the only individuals who have the ability to submit an application. If you have both roles, you will need to log out and log in as the SO. Okay, so I am the SO here, so I'm going to go ahead and submit. It's going to run those business rules validations again, and if I failed, it's not going to allow me to submit. In this case, we were fine. The application has been submitted, and then we would be sending out emails to let you know that your application has been submitted. And then this is the part that I really wanted to emphasize. Don't go celebrate yet. What you want to do is you want to go here under status and set view. And again, I should have shown you before, but sorry. You can use, let me come back here, check again for status. So it has completely processed the application. And how do I know that? Because I now have an agency tracking number 4923367. But I forgot to point out a couple of other things. Before you submit, it is a very good idea to preview the application. That way you're sure that you have not included your kid's homework as one of the PDFs, that you haven't included something that has track changes, or that you haven't given us your favorite cranberry margarita recipe, which I know this is this actually has happened. And so again, we've gotten a whole bunch of things because people haven't previewed their application. Thank you, I like the tears, ahead of time. The other thing I want to point out, that if I did exactly that in previewing it, as we're going to do in a second, I find that something is wrong, I can put in that change corrected application within the 2-day window. And this is the number I need to cite. This is the submission tracking number. You will always find this application information associated with this submission. So you don't have to make sure that you write it down at the time. So let's look at our application. All I have to do is click on that accession number. And now we are moving over, leaving Assist, and we are now in eRA Commons, and we are in Alexander Abella's grant folder, and that's seen here. Grant folder. The grant folder is exactly as it sounds. It's like a vanilla folder, something that you would have in a file cabinet. This folder will accumulate all of the information associated with this application during its entire life cycle. So this this ROA has seen its full grant number. So its full grant number is 10T2. That's the activity code. This happens to be the IC it's assigned to for potential funding consideration, and this is a unique serial number. Here's the title. This is another unique identifier associated with the record. And then here is your application. So if you can now see your application in Commons, we can see your application. So what we do when we process the application is we put on a header. In this case, we cite the contact PI. We assemble the application with a table of contents. In your case, you're going to see the table of contents, these two forms, and then your PDF here. We will not be able to break it out into components since it was submitted as a single PDF. And then, so this is what the core form looks like. This shows the tracking number. Here is the time of submission. You can see the page numbers have been added. And then the attachments are added in the order in which they are assembled. So you'll see in a second, you'll see the abstract. And again, I just had a blank PDF. Then it'll be the specific aims, and then it will be the attachments in the order that they have been added. So in this case, BioScratch, this was the data management sharing plan because it tells you what it is down in the footer. And then the last attachment that we put in was sort of the research plan. And this was the title of that research plan. So there you go. So we now have our assembled image, and then the program has it, and it's all ready and good and set to go to review. So I'm going to stop sharing. I think, David, if you can bring back up the slides. I just want to leave you with a few take-home messages. So as Jennifer indicated, register early. That should be the first thing that you do after leaving this webinar is make sure that if you are registered, that you know your credentials. If you're not registered, begin the process. You may use that streamlined OTA process that does not require a UEI. The person who is responsible for registering an organization is their signing official or authorized organizational representative. They will need a username and password. Once they have the organization registered, they will go in and affiliate at least one person with the role of PDPI or principal investigator, who will be responsible for the project that is being submitted. And to access Assist, you must have Commons credentials. And so it doesn't necessarily need to be limited to the PDPI. We have a number of other roles and privileges associated with eRA Commons, such as assistant. But again, anyone who will be accessing Commons and Assist will need a username and password. If one person is serving both roles, they will need 2 registrations. Make sure you read the instructions, not once, but twice, and make sure multiple people read them so that you're all very clear. Your major attachments, in addition to the specific aims and abstract, should have a specific file name, which has been provided by to you in the ROA. Each file name must be unique and be 50 characters or less. And that's in bold. I mentioned that in number 2. Again, you want to enter the OTA, the ROA as OTA 23-007 or 007 or 008. Because you are registered, your information about the organization will be pre-populated. If you elect to enter the information about the PDPI at that time, at the time of initiation, you can do so, and you have the ability to edit. You will be required to have a SAM registration with a unique identifier back at the end for once you at the time of award. And again, remember that you need 4 core elements. You need that core form completed. You need the abstract, specific aims, and your attachment. Edit allows you to edit, and save and release, or save and keep, allows you to either release the application or the core form back to other users, or keep it while you go and get some coffee or juice. Don't worry about adding additional forms. They're not needed. You must complete every field that has an asterisk. And again, please do not use bundling or portfolio features for combining your PDFs. If you don't have an EIN, you can add 12 ones. Good idea to name your abstract, and specific aims, because as you saw, that's how they appear in the assembled image. You want to pre-validate your application to make sure that you're not missing anything, or as you saw, that you don't have a PDF which is corrupted. And again, you want to preview to make sure that you have the documents that you expect in the expected order. So that's a really good thing to do, again, before you submit. And then again, reminding that your application must be error-free at the time you want to submit. And most importantly, it again is the individual with the role of the SO who must complete that submission process. Make sure you do look at the application and comments. I can't tell you enough how important it is to do that, because again, if you can't see it, we can't see it, we can't review it, and we certainly can't fund it. So best of luck to all of you in this process, and I'm happy to answer any questions at the end.
Thanks so much, Laura. And again, the focus of our webinar today was really to help people with that step-by-step registration for ERA and then entering through Assist. So we really appreciate that detailed information. We're going to quickly do some wrap-up items. So just some highlights of the program. NCREW is designed to provide novel, accessible, culturally grounded training, resources, and tools to build research capacity in communities and to advance the application and integration of Indigenous knowledge in NIH research. It leverages OTA to facilitate the NCREW program and participants quickly pivoting in response to lessons learned and new or evolving needs. Hopefully we've made it very clear that you should register your organization in eRA Commons as soon as possible. And once you have your credentials, try to access Assist. Follow the directions on how to complete an application, and for submission related issues, contact the eRA service desk. If your issues cannot be resolved after you have exhausted those resources, please feel free to also send an email to ncrew at nih.gov to let us know what's happening on your end. I want to highlight upcoming technical assistance. We do have a session scheduled for October 3rd. This is just an open session for questions and answers that people can submit at that time. Please email any questions to ncrew@nih.gov, and please do check the questions and answers document that is on our website. It is updated regularly as we receive new questions into our email address. We do post those questions and answers in that document. So I want to say thank you. You didn't get the chance to meet everybody on the core NCREW team at the NIH today. So just highlighting Jacqueline Smith and Nakia Brown, who did not hear from. And we're going to move now into the question and answer session, and Angela Walden and Carly Marshall will be facilitating that for us. A reminder to submit your questions through the website, and I'm going to turn it over to Carly and Angela now. Welcome.
Thank you so much, Kathy. Hi, everybody. My name is Carly. We want to thank you all for being here with us today. We're going to use the rest of our scheduled time to respond to questions about the NCREW program and the application process. We also want to extend our sincerest thanks for folks who have submitted questions either at registration or here in real time. And I also want to note that we received a few questions about the program and ROAs pertaining to eligibility and content areas. But because these topics are covered thoroughly in the first webinar, we want to remind you that the recording of that webinar is available on our website. The NCREW website also describes the program and links to each of the active ROAs, that is OTA 23-007 and 008, which I'm sure you've heard a lot today, as well as our questions and answers page. We will address as many questions as we can in our remaining time, prioritizing those that are most relevant to the content we covered today. And as mentioned multiple times, a recording of this webinar as well as an updated Q&A will be posted to the website soon. So with that, I'm going to begin with our first question, which my colleague Angela will answer. So the question is, when I register in eRA Commons, what type of opportunity should I select? There are many options.
Hi, everybody. Angela Walden, part of the NCREW team. Happy to answer questions. So the question was, when I register in eRA Commons, what type of opportunity should I select? There are many options. When OTA applicants submit their eRA Commons registration, they should select NIH Other Transaction Authority opportunities. There are two other options, but NIH Other Transactions Authority opportunities is what you want to select. So only select that one.
Thank you, Angela. So our second question is, I registered as my organization's signing official on our eRA Commons registration and want to know what happens next.
So once the registration is submitted and approved by eRA, the signing official, also known as an SO, will receive an email to verify before the registration is completed and any account information is sent out. So you would want to check for that email. Registrants should follow the process for eRA Commons registration, which is outlined on their website. It's a long URL. I'm going to say it all, but this will also be in our Q&A on the website. So you can look at this later if you can't catch it all. But that website is era.nih.gov/register-accounts/register-in-era-commons.htm. So that's where you want to go to ensure a successful Commons registration.
Great. We have another question, which is, do all of the key personnel, so for example, the co-investigator, senior key personnel, other significant contributor, collaborator, consultant, or sub-awardees, etc., listed on our application need an eRA Commons ID to submit our application?
This is not required, but it is helpful. So the answer is no, but helpful. For submission, at a minimum, there must be the signing official, that is the SO, with signature authority for the organization, and there must be at least one person with the role of principal investigator, also sometimes called PI, with the organization. So the application must be submitted by the individual with signing official credentials. However, please note that it will be helpful to NIH if any key personnel are registered in eRA Commons.
Thanks, Angela. So we got a fourth question, which is, what do I do if I have trouble submitting an application?
Please submit your application several days ahead of the receipt date so that there's time to troubleshoot any problems. If you have any issues with submitting your application, you would want to contact the eRA help desk. If you continue to have problems submitting, you can email us. We ask you to please do that at ncrew, that's increw, at nih.gov.
Great. Our next question is, can one individual serve in both the signing official, SO, role and the principal investigator, or PI, role in eRA Commons?
It is strongly recommended that the SO and the PI contacts are different people. If this is not possible, the individual serving in both roles will need both the signing official role, admin, and a separate username and password for the principal investigator or PI or science role in the eRA Commons.
And another question kind of building on that previous one is, what is the difference between the signing official and the principal investigator roles in eRA Commons?
It's a good question. The signing official holds the authority to legally bind the organization and assume responsibility. The signing official also registers the organization and maintains profile data, accesses information for all applications, including status and award information. And should an application be awarded, the signing official will be defined as the business official in the other transactions agreement. So this individual must be authorized to act for the organization and to assume the obligations imposed by federal laws, regulations, and requirements and conditions that apply to other transactions. The principal investigator holds eRA Commons role as the designated program director / principal investigator, or the PD/PI of an application. That person has can access information for an application and award information, has the ability to maintain person profile information, can check application status, can review assembled application images, image used for performing post-submission administrative functions, things like that. Should an application be awarded, the PD/PI directs the project or activity being supported by the other transactions mechanism and is accountable along with any other PI listed on the OT award if there's a multiple PI situation to the organization for the proper conduct of the project or activity. There can be multiple PD/PIs. If this is the case, all of them should be registered and have the PD/PI role in eRA.
Thank you. We have another question, which is, where can I find the recording and slides for the first NCREW webinar held in July? And I hope our slide gives a good hint.
Yeah, so the first NCREW webinar discussed in detail the background of the NCREW program, the two current research opportunities, which you also heard about in this webinar a little bit, and highlighted the application and review process. The links to the recording and the PowerPoint slides for that first webinar are available on the NCREW website.
Perfect. Question for you. Can I upload my references as a separate attachment? Is there a limit to references? And where should I attach my references in the proposal?
References are not required for the OTA 23-007 application. If you want to include them, you can include them at the end of the planned activities, approach, and key personnel section. The references do not count against the 12-page limit for this section, and there is no page limit for the references. Note that your full application, including any references, should be combined and uploaded as one PDF file. You'll want to make sure all information is completely visible in your PDF. In other words, as mentioned earlier in the webinar, do not use things like bundling or portfolio features, which combine multiple documents into a single file by providing links to the individual files. So again, one PDF file.
Thank you. Our next question is, what is meant by research in the research opportunity announcements?
So that's a good question. Curiosity and the need or desire to understand how things work, including about health and well-being, have driven efforts throughout all human history to seek answers to questions about ourselves, our communities, and the world around us. The process of seeking answers has evolved into what some people call research. In the most general terms, research can be understood as a methodical approach used to answer a question. It's typically based on or meant to test or extend an existing theory or create a new theory. Everybody can play an important role in each of the many steps that make up the research process, from formulating research questions to translating research findings to action and/or policy. Research begins with one or more questions. Research question is important because it will drive the research project or process. The research approach should utilize methods that are well suited to answering the research question to obtain results that one can have confidence in. And additionally, the approach should be tracked from beginning to end, from the formation of the research questions through the reporting of results, in order to transparently document and demonstrate quality and reliability of the process and results.
And to build on that a little bit, can you talk a little bit more about the research process?
Sure. As I mentioned, that process starts with a question. The question could stem from an observation. It could stem from previous research findings or frameworks. And from there, if you're testing or extending an existing theory, you'd want to incorporate that question into or let it guide your planning for the project. There are many existing research traditions and methods, including indigenous research methods, each with their own standards for rigor, that is, parameters for judging quality and reliability of the research process and results. Research traditions and methods may also require the creation or refinement of standards of rigor. And further, the research process may not always move forward in a linear fashion, meaning that sometimes steps in the process are revisited for a variety of reasons, like researchers may become aware of new information or theories during the process, for example. All of those factors support the use of a systematic process that's well documented throughout the project. The NIH, of course, is committed to promoting rigorous and transparent research in all areas of science. Applicants are encouraged to consider a range of indigenous and/or Western methodologies and approaches, including those that rely on indigenous knowledge or the lived experience of indigenous researchers or practitioners as applicable, or some combination thereof.
Thank you, Angela. And thank you all for these great questions. We have about 7 minutes left, so we'll see how many more we can get through. But our next question is, since the NCREW program is funded through HEAL, will research or data projects on pain management require the normally required common data elements?
That is a great question. So what we can clarify is that core HEAL defined common data elements, or CDEs, can be found in the HEAL CDE repository. And again, this question will live on our Q&A website. There's going to be a link to that. The supplemental CDEs will be added soon, and in the meantime, they can be accessed by contacting HEAL_CDE at hsc.utah.edu, and that is going to be on our website as well. The INCRU program, in partnership with tribes and Native American serving organizations, or what we've been calling TNASOs, may develop common data elements that are appropriate and meaningful for tribes and Native American serving organizations. And while not required, we encourage applicants to consider and use the HEAL-defined CDEs for pain projects and as relevant for addiction projects. Further, for all research and data projects, including clinical pain research studies, the final project requirements will be negotiated prior to an award. To award the ROAs will be negotiated prior to an award. The ROAs include CDE as an example milestone that programs may consider. So quoting from the ROA, applicants should include other milestones that align with the activities they propose for phase 1. The milestones submitted by the applications will be evaluated, but final milestones will be negotiated in collaboration with NIH and based on the application and other INCRU program resources and needs. So we have a couple of examples. Well, one example, really, work with partners to identify common data elements to be collected and shared across sites that conform to tribal policies and practices. So that's an example that folks might find useful, but just note, please, that that's an example and not a required milestone.
Thank you, Angela. We're going to skip to a couple of questions that just came in to ensure that we get those answered in time. So the first one is, are the following statements sufficient to meet NCRU's definition for core mission to serve Native Americans? So an academic center is committed to serving Native communities throughout the state in partnership with Native nations and our urban Indian communities through research, education, and community outreach activities. Additionally, the academic center is home to an American Indian Resource Center, which has stated a mission to increase communication and collaborative relationships with tribal nations and American Indian communities throughout the state. It's a long one. It's a good one, though.
It's a long, good question. Applicants should provide detailed information to emphasize how their organization maintains a core mission to serve Native Americans. Please keep in mind there's some information from the ROA that's critical here. So keep that information from the ROA and ensure these goals are addressed in the application. So I'm going to list those. There's 4 here that I'm going to list. 1, INCRU program focuses on 3 main goals that reflect priorities for addressing the opioid drug overdose crisis identified in tribal consultations in 2018 and 2022 and through community input. So within I guess I'll revise what I was going to say. There are 3 main goals and they come from these consultations. Those are support TNASOs to lead community prioritized research projects, including research evaluating and integrating Indigenous knowledge and culture. Enhance capacity within TNASOs to conduct locally prioritized HEAL-related research, accomplished through the development and provision of novel, accessible, culturally grounded technical assistance and training resources and tools, and to improve access to and the quality of data on substance use, pain, and related health and well-being factors to maximize their potential for use in local decision-making. So priority consideration also will be given to applicants that can document a commitment to advance their research capacity to participate in future NIH research. That's important to keep in mind. The INCRU program intends to build research capacity within TNASOs. Therefore, NIH will prioritize meritorious applicants who have not previously applied for or received NIH funding for this for ROA-23-007.
Thank you, Angela. And we have a couple minutes and a couple short questions left, so we'll see if we can get through all of them. So the next question is, if our project requires IRB review, what additional documentation do we need to upload in Assist?
Additional documentation is not required by this ROA at the time of application. Other Transaction Authority provides NIH the flexibility to work with applicants to receive this documentation if needed prior to any potential award.
Thank you. The next question is, if one person has both SO and PI roles, do they need to use 2 different email addresses to register?
No, you will need 2 different eRA Commons registration roles with different usernames and passwords, but you can use the same email address for both of those.
Great. And our final question today is what if our current SO is no longer with the organization? What is the process for updating our SO? Is it the same as registering a new SO?
If your SO is no longer with your organization and you have no other individuals listed currently as SO, please contact the eRA service desk for assistance with that one.
Great. Thank you so much. I'll pass it back to Kathy.
Thank you so much, Angela and Carly. And we just want to thank all of the attendees today, and also want to remind you that we are grateful for your time and attention, and please reach out to us at ncrew@nih.gov if you have any questions. Again, thank you and have a great rest of your day.